Good evening, everyone, and welcome. I do want to let you know off the bat that this event and all content is being recorded to aid in executive documentation and for later viewing. Your continued participation is acknowledgement and approval of recording. If you prefer to not be on a recorded event, please do log off at this time. Again, welcome everybody. My name is Samantha Cosman. I am one of the Regional Program Outreach Coordinators for the PA Vet Connect program at the Pennsylvania Department of Military and Veterans Affairs. On behalf of DMVA, I want to thank you for joining us. This is our second event in a series of 5 virtual veteran town halls. Tonight's topic will focus on serving older veterans. So let's start off by doing a poll. We would like to get an idea of who is joining us tonight. So you should see the poll appear on your screen shortly. What we would like to know is for you to select the option or options that best describe you. Are you a veteran, a spouse or surviving spouse of a veteran, another family member of a veteran, a caregiver to a veteran, or an advocate or professional working with veterans? Once you select the option or options that best describe you, please do be sure to click the Submit button to record your response. We're going to wait just 10 to 15 seconds to allow everyone to participate in the poll. Okay, Corey, can you share with us what our results are?
Yes, let's take a look here. Majority of our audience here this evening are advocates and professionals, and also our veterans.
Great, Corey. Thank you so much. Again, we're very excited to have everyone on with us tonight. Now, throughout the evening, we will have a few additional polls that will appear on your screen, just like that one did, and we hope that you'll take the time to participate in them. Additionally, at the end of the event, there will be an opportunity for you to provide us your feedback via a short post-town hall survey. Now, that survey will appear as a link placed in the chat panel at the end of the evening. So please do stay with us for the whole event, not only to be able to hear the wonderful information that our advocates and subject matter experts have to share with us, but because we would also really appreciate your feedback regarding how this event went over tonight and if it was informative to you. Now, I just mentioned that that link will go in the chat panel, so let's discuss our chat panel a little bit. That is the mechanism that we are going to use for everybody to ask their questions. So if this evening you have a general question, please feel free to put the question in the chat panel. And we have a team that will be reviewing that panel throughout the night, and they'll be providing answers to you. We do ask, however, that you refrain from sharing any personal situations or issues because everybody will be able to see them. So again, general questions can go right into the chat panel. But if you have something that's a little more of a personal nature, maybe an issue that you've been trying to resolve and you need some assistance, there are 2 ways you can go about getting our help. One, if you feel comfortable, you could place your first name, last initial, and a good way to contact you into the chat panel. So for example, Joe S. at, this is my phone number. Someone from our team will reach out to you within 3 business days to discuss your situation with you and do everything we can to help you. The other avenue that you could pursue is by emailing the PA Vet Connect team at the email address noted on your screen. This is a resource account for our program. It is monitored every single workday. So If you have something personal, please do use one of those two methods. I hope everybody by this point has found their chat panel on their screen. You'll see on the slide, we give you a little picture of what that icon looks like. You should see it across the top of your screen, and you'll want to activate your chat panel now if you have not done so already by clicking on that chat icon. So at this point then, we're going to go ahead and do another poll. It's kind of really our first poll of the evening. Corey's going to launch it on your screen, and we're going to give everyone a little bit of time to read it and to put in their answer. Don't forget to click the submit button. The question being, true or false, more than half of Pennsylvania's veterans are age 60 and older. And again, we'll just give 10 seconds or so for everyone to participate in this poll. And the answer to that poll question was true. Over half of Pennsylvania's veterans are age 60 and older. And with that being said, there is a whole world of support that exists for our older veterans, their family members, and their caregivers. And tonight we're very lucky because we have a very nice panel of subject matter experts for the Aging Network, as well as some very fierce veteran advocates with us. So joining us this evening, we have Deputy Adjutant General for Veterans Affairs, Maureen Weigl, Secretary for the Pennsylvania Department of Aging, Robert Torres, Director of Long-Term Care at the Department of Military and Veterans Affairs, Travis Davis, Director for the PACE program out of the Pennsylvania Department of Aging, Tom Sneddon, Admissions and Outreach Coordinator with the Bureau of Veterans Homes at the Department of Military and Veterans Affairs, Eugene Misdale, our General Caregiver Support Program Coordinator with the James E. Van Zant VA Medical Center out of Altoona, that's Renee Shandor, and then our Mobile Distribution and Programs Manager with the Central Pennsylvania Food Bank, Pamela Hicks. Throughout the course of the evening, all of these individuals will be sharing some very important information with you. And at this time now, I have the great pleasure of introducing to you Deputy Adjutant General for Veterans Affairs, Maureen Weigl. Brigadier General Weigl served her country for 25 years in the Army Reserves, Active Army, and National Guard components. Since retirement in 2016, she serves on nonprofit boards which help veterans and spouses, teaches military history, and remains very active in her community. Ma'am, at this time, I'm going to turn it over to you to lead us in the Pledge of Allegiance and for your remarks.
Sure. Let's start with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, Sam, and thank you everybody for joining us. It's very exciting for us to have our second town hall. You know, as Sam mentioned, over half of the population of Pennsylvania veterans are over the age 60. We have close to 800,000 veterans in Pennsylvania, and over 300,000 are age 60 and over. The majority of our veterans are still Vietnam-era veterans, although post 9/11 and Gulf War veterans make up about 261,000 veterans. I will tell you, I've been in this position as the Deputy Adjutant General for Veteran Affairs for the last 15 months. In this position, I oversee 6 long-term care facilities, 2 in Philadelphia, 1 in Scranton, 1 in Hollidaysburg, 1 in Pittsburgh, and 1 in Erie. I also oversee all of the veteran programs. I work with the 67 county directors. And in Pennsylvania, we have 2 very unique programs that make Pennsylvania special to take care of all of our veterans. We have a Governor's Advisory Council for Veteran Services. And as such, we work with all of our sister agencies, Department of Aging, as we are here tonight, Department of Health, Department of Human Services, Department of Fishing and Boat, Department of Agriculture, all of our sister agencies to tackle really serious issues concerning veterans, whether it's economic workforce development and employment, homelessness, suicide prevention, aging, women's issues, or corrections and judicial issues. We work together as a community in the departments for Pennsylvania to take care of our veterans. And tonight is a testimony seeing that the Secretary of Aging joined us this evening. We also work with all of the 67 county directors and the veteran service organizations, the American Legions, VFWs, DAVs, all of you that I'm sure are online tonight for this very important topic of aging. When I travel around the Commonwealth, I will tell you the two most critical needs of all of our veterans are transportation and options for long-term care. So I'm very excited that tonight we have a panel to discuss these options, programs, and benefits to all of our aging population of veterans. Between Secretary Torres and Travis and Tom, I think we can really have important discussions that are relevant today for what you need to consider for long-term care, whether it's for you or a loved one or someone in your organization. So I really thank you for joining us this evening. This topic is extremely salient, and I hope that it benefits you. And please do not be shy to ask any question. The experts are here in the room with me. I obviously am not a long-term care expert, but I am a veteran. I take care of veterans. I want to make sure we're providing the benefits to you. So please ask the questions, speak up. We will address all of your needs. I'm hoping we can provide the information to you. So at this time, it is my distinct honor to introduce to you the Secretary of Aging. Sam, please switch the slide. Secretary Torres is an advocate for all Pennsylvania aging population, not only veterans. He has been a friend and an ally for all of our efforts, and we are really honored to have him. At this time, I'd like him to talk about not only our Long-Term Care Council, but what he's doing and what he's done over the past few years with the Pennsylvania Department of Aging that can help all of our veterans. Sir, thank you so much for joining us.
Thank you, General Weigel, for the invitation. And it's a pleasure to be here. I began my tenure as secretary back in January of 2019, and I quickly worked to develop a relationship with the Department of Military and Veterans Affairs because I wanted to make sure that any services that we could complement in terms of services that were being provided by the Department of Military and Veterans Affairs we were aware of, and also, vice versa. One of the things that we've been working on since my arrival is really strengthening our protective services efforts. There's unfortunately a lot of elder abuse that has existed in Pennsylvania and has increased over the last 5 years. So that's been a priority for our department. So cases of abuse, abandonment, neglect, financial exploitation, all of those different issues we're dealing with. But our department is charged with serving individuals age 60 and above. We do that through 52 area agencies on aging that serve the whole Commonwealth of Pennsylvania. So for those of you who are listening in, if you have a need for services and you're above 60, we have a variety of programs. If you're interested in senior centers, there's over 500 senior centers that are affiliated with the 52 area agencies on aging. So you can get service there. The area agencies on aging will do intake and assessment, so do not make any assumptions about what services you might or might not be entitled to. I would encourage you to visit an area agency on aging, and they'll do that work for you and figure out what you're entitled to or what services may complement services that you're already receiving, being a veteran. We have health and welfare services, so programs that help to manage diabetes, help with, developing your balance so you're not at risk of falling and hurting yourself and seeing your quality of life go down. And we have pharmacy assistance services, which our director, Tom Sneddon, is here and will share some of that information. We also have a clearinghouse. It's what's called a patient assistance clearinghouse, which offers services for people that are not 65 and above within our pharmaceutical program. So lots of services that you can take advantage of and that we'll be happy to get into more details about.
Thank you, sir. At this time, I'd like to introduce you to our other panelist, Travis Davis, the Executive Director of Long-Term Care for the Department of Military and Veteran Affairs. As such, Travis has the management of our 6 long-term care homes that I mentioned previously. Travis came to us with a wide array of experiences from the private industry and long-term care. We are excited to have Travis and his leadership at the homes. And Travis, I'd like to introduce you to the team and the group.
Good evening, everyone, and thank you for having me, and thanks for joining us at this town hall tonight. As General Weigel had mentioned, my name is Travis Davis. I'm the Executive Director of our Bureau of Veterans Homes and responsible with the oversight and direction for our 6 state veterans homes across the Commonwealth. We provide an array of services, including nursing, memory care, personal care services to our PA veterans and spouses. It's really an honor and a privilege to be able to give back to those who have served and given so much to our country. Our mission is quite simple, and it's really to provide the highest quality of services and care to our veterans and their spouses. We want to be the premier choice for all Pennsylvania veterans when seeking long-term care options. We believe we are right now. We're doing a great job. We have a lot of exciting things going on in the state with over 2,000 employees and 1,500 beds to service our veterans and their spouses in the state. So it's a privilege to be here, and I'm looking forward to some questions from the group.
Thank you, Travis. I would like to ask both of you a question. Secretary, you mentioned that there are 50 area agencies and 500 senior centers. What is the best way for a veteran or their family member or caregiver to connect to these services and resources?
The best way would be to contact your local area agency on aging. You can find those at our website, aging.pa.gov. Or you can call your local county. They'll be able to refer you to the local area agency on aging that supports your area. That really is the first step. And then again, as I mentioned, they will take the time to do intake and really assess what services you're eligible for.
And Travis, you mentioned 6 long-term care homes, and you have the best facilities, or we have the best facilities. How does a veteran or a caregiver find information to place their loved one in the home and to find eligibility for the home? I know Jean's going to talk in a minute, but what's the quick way to find the website where they can find that information?
Sure. So the first thing I would do is check out our website at dmva.pa.gov and click on our Veterans Homes tab. That gives information about our 6 locations. It gives information about our admission numbers for all 6 homes. I am pleased to have Jean online. Jean will be speaking later in this town hall, talking about the admission criteria and what that process looks like. But I would encourage everyone to check out the website, look at the facilities that are closest to you. And if you have a loved one who is dependent on someone to care for them, and long-term care may be an option that you would like to seek in the future, I encourage you to apply. There's really no harm in applying. You're not committing to anything. But we do have waiting lists to get into the majority of our homes right now, and they are quite extensive in some areas. So I encourage everyone who in the back of their heads are thinking that, long-term care placement could be an option, may be an option that we would have to go down. I'd encourage you to look at the application and let our team help you and guide you along the way of applying to get into one of our state veterans homes.
Thank you. And sir, you mentioned, the 500 senior centers. What other types of resources are available for the aging demographic in Pennsylvania that they should look for, or maybe they haven't thought of that's available to them?
Well, we provide some home and community-based services. So again, if you go to an area agency on aging, they'll assess your needs. They'll do care management, in-home meals if that's something that is needed in the particular set of circumstances. And then, depending on the AAA that you're dealing with, they at least have the options of providing other types of services like emergent care, transportation, home modifications. But all of that has to be assessed to see, what your particular set of circumstances are and whether you're eligible for some of the services.
And am I assuming that that's for veterans and spouses? It doesn't matter. Your services are open to all aging populations?
Our services are open to anyone above 60. We do have a small employment-related program that goes down to 55, but generally it's 60 and above. And We do have a, excuse me, a caregiver support program. So again, that may be someone who is not 60 and above. It could be anyone 18 and above, depending on the particular set of circumstances. It could be a grandparent who's raising a grandchild. So again, I just want to encourage everyone that if you have some of these needs, come in and we'll do an assessment and make sure that you're pointed in the right direction.
Wonderful. Thank you, sir. And I know Secretary Torres, you have with you Tom Sneddon to talk about PACE and Clearinghouse. Would you like to introduce Tom at this point?
Yes, I would. Thank you. Tom Sneddon is our director of our PACE Assistance Program. We serve older adults 65 and above that meet certain income limits, but we also have a Clearinghouse program that I'm going to let him talk about because they do a great job of not just providing the prescription assistance, but connecting individuals that they're supporting to a lot of other services.
Thank you, Secretary. And good afternoon, everybody. The PACE program is an acronym for Pharmaceutical Assistance Contract for the Elderly, and it's the Commonwealth's premier pharmacy benefit that's been around since 1984. Over time, the program has evolved a mission to help anybody enrolled in the benefit to get other benefits that might make their lives better. So things like property tax and rent rebate, the food programs like SNAP and Senior Food Box, LIHEAP for energy assistance, the Medicare low-income subsidy benefit, which is a comprehensive benefit within the Medicare Part D benefit. There are a lot of services that we provide through what we call the PACE Clearinghouse. Back in 1999, the legislature amended the PACE statute to require the program to serve anybody 18 years of older through the Clearinghouse to get them assistance they need to address needs in their life. And the hallmark of the Clearinghouse is that we will do the applications for individuals. Whether it's a Medicaid application, Medicare low-income subsidy application, property tax and rent rebate application. And we will batch and send those applications to the agencies that administer those programs. And we will also be the intermediary for the individual if the application is rejected or additional documentation is needed. And we follow up with the individual to make sure that if a renewal is necessary, we can help them do that. We have currently about 12,000 veterans in the PACE pharmacy benefit, which is probably an undercount because not everybody checks the block or not everybody really understands veteran versus service versus some other term. We also have enrolled 500 people in the DMVA homes across the state. We work with each of the homes to make sure that if there's a vet in the home that needs help paying for pharmacy benefits, then we will enroll them in PACE. We got 500 in homes. And it's hard to say how many vets we've helped through the Clearinghouse because it's not a question we ask people when they call in for help. But most assuredly, we've helped any number of vets. So anybody, including vets, that needs help with anything to make their life easier, including a hearing aid battery, just call us. 1-800-955-0989. That's the number. For the Clearinghouse, the hours are Monday through Friday from 8 a.m. to 5 p.m. After hours, calls are recorded and followed up the next day. Thank you.
Thank you so much. For many people on the line, you might not realize that some veterans do not qualify for VA benefits through the hospital. So PACE is a great opportunity for them to receive the benefits that they need that otherwise would not be able to get through the VA. So if you do have a loved one who is a veteran but does not qualify for VA benefits from the VA hospitals, please go to PACE. Is there a website or is it just the 1-800 number?
This website that the Secretary mentioned, just come in through the Department of Aging website.
aging.pa.gov.
There's many people and there's many resources. So even if you think that the VA doesn't take care of you, my father is a post-Korean War veteran, pre-Vietnam, so he didn't have wartime service. And there's many veterans in that category that don't qualify for VA medical benefits, but are aging and require some assistance. So please share the PACE information. I think it's extremely useful. Thank you so much for sharing that with us. At this time, Sam and Corey, are there any other questions before we move on to talk about long-term care nursing homes with Jean that the group might have for us? If anyone has questions real quick on the topics we discussed, we'd love to address them.
Corey, have there been any questions that have been entered into the chat panel that we can address verbally?
Thank you. No, I do not see any. You answered the one in the chat panel about the phone number. Thank you.
Yes, and for anyone who has just called in and does not have access to the chat panel, we'll just repeat it briefly. That Clearinghouse phone number is 1-800-955-0989, and it's operated Monday through Fridays, 8 a.m. to 5 p.m. with an after-hours voicemail answered the next business day. Okay, then we will keep moving on through this town hall.
Sam,
yes.
Sam, real quick, I think the secretary would just like to make one more closing comment on that. Hold on.
Yes, just a quick announcement for the audience. Last week, we published our 2022 Benefits and Rights book for older adults. It's a compilation of every service, not just within the Department of Aging, but all other state agencies that are available for older adults. So it is on our website electronically, but we can also make hard copies available to anyone who might be interested. And if you are, you can call our main line, it's 717-783-1550, and we'll certainly get them out to you if you're interested in a hard copy.
Thank you. Thank you, Sam.
Yes, thank you very much to everybody for the great information you just shared. At this time, we're going to go ahead and go to our second poll question for the evening. So you should be seeing that on your screen at any time. And this question just wants you to select from the options below who could live at one of Pennsylvania's 6 veterans homes. Go ahead and select your option and then click submit. We'll give about 10 seconds. Okay, and the answer to that question is all of the above, because every day Pennsylvania's 6 veterans homes are providing quality and compassionate care to veterans as well as the spouses and surviving spouses of eligible veterans. And that question really leads us into our segment for the town hall around our veterans homes. And to brief us on that information is Mr. Eugene Misdale, the admissions and outreach coordinator for the Bureau of Veterans Homes at the Pennsylvania Department of Military and Veterans Affairs. As the admissions and outreach coordinator, Mr. Misdale has working relationships with each of the 6 Pennsylvania veterans homes, especially with their admission and outreach coordinators, their volunteer coordinators, and their activity directors. He is also a retired lieutenant colonel from the Pennsylvania Army National Guard, serving 26 years in a part-time capacity. So Gene, I will go ahead and turn things over to you, sir. Please just tell me to advance on your cue.
Thank you. Good evening, everybody. As General Weigel and others spoke, there are 6 long-term care facilities in Pennsylvania for veterans. Here they are with a map of Pennsylvania. Starting up in Erie is the Pennsylvania Soldiers and Sailors Home. Now, what's unique about that home, it's the oldest of the 6. It dates back to 1886. It's been providing long-term care since that time for Pennsylvania veterans. In the lower left-hand corner in Pittsburgh is the Southwestern Veteran Center. Right in the center of the state is the largest of the 6 homes, which is Hollidaysburg. That home actually has 424 beds at that home. Going up to the northeast corner of the state in Scranton is the Geno J. Murley Veteran Center. That is right downtown Scranton. Going to the lower right-hand corner is the Delaware Valley Veterans Home, which is in the city of Philadelphia, in North Philadelphia. Not far from it, in Spring City and Chester County, is the Southeastern Veteran Center. So that is the 6 homes across the state. Next slide. Really what everything starts, the process is like an application. As we mentioned the website already, the application is online. It's kind of broken down to 6 parts. General information, but what's really essential, like with any veteran's benefit, we do need a copy of the veteran or the spouse of the veteran, the DD-214, or military discharge if it was before 1950. So we do need a copy of that to move forward with the application. We kind of take an overview of the financial situation at the start. I'll talk a little bit about that in the next slide. We also have like a signature page if we need signed by the veteran or the power of attorney for the veteran that allows us to legally move forward with the application to work the process for the veteran. 2 forms that are very essential, which are part of the application, is the MA-51, which is the Medical Assessment 51 sheet, and the Activities for Daily Living Assessment sheet. Both of those do require a physician's signature. We always say it's the local doctor that knows the veteran or the spouse the best. And we always like to work our outreach survey to help other veterans in PA to find out how people hear about us. Slide. This slide has a lot of information on it. It's the eligibility. Again, we are set up for Pennsylvania veterans. A veteran or surviving spouse is eligible for veteran. You have to serve honorably in the United States Armed Forces or Pennsylvania National Guard. You have to be a current resident of PA or have listed PA as your home of record when you join the military. Thing with that is the people that live, the veterans that live in Pennsylvania do have priority. The people that have moved out of state and are now living in a second state would be on the secondary wait list. So the primary wait list has the priority. We're based on the veteran's ability to pay. We look at each veteran on a case-by-case basis, and what our team at the homes come up with is a maintenance fee what that veteran would pay out of pocket. Then depending how long the veteran is there, we work with the families, and the total cost of care versus what they paid out of pocket could be applied to an estate recovery plan. Just a couple things I wanted to get across to the folks. We will not deny anybody for inability to pay. It's based on your ability to pay. We do have to get approval by the admissions committee at that home. We do look at the different medical necessities, and we want to make sure that we can provide the medical care that's needed for that veteran. Everything is done on a first come, first served basis. And it goes by home, of course, and it also goes by level of care, what's determined by that admissions committee at that home. Fine. Really what we're trying to do is just help the veterans keep staying active. This is some slides of some things from the home. You see a pool table up there. The middle picture has a canteen. All 6 homes have a canteen. There's physical therapy at each of the homes, as you see in a couple pictures. A couple activities in this slide are like a gardening class we've had and a woodworking class in the lower right-hand corner. Slide. Again, trying to keep the veterans happy and living. We really try to focus on a lot of major events throughout the year. What we have coming up in just a few weeks is we call the State Veterans Homes Week. It's always been around Flag Day, ending the Sunday of Father's Day. So a lot of the homes will have Flag Day ceremonies, as well as have carnivals and a few other activities, and they'll usually end the week like with a Father's Day breakfast. The sharing and caring traditionally has been in the past. It's actually a boat ride in Pittsburgh where the 3 Western homes come together. That's the center picture as well as the upper right-hand corner. That we sail the rivers in Pittsburgh and they have a band play and good meal. So the veterans that get to attend that, it's very rewarding and very enjoyable. That's like one of the big events for the 3 Western homes. The big event, which is coming up even sooner than Homes Week, is the Adjutant General Fishing Derby every year in northern Dauphin County. Again, we bring the 3 Eastern homes together, and the guys compete, and veterans compete for fishing and have different prizes, and they have a good time. We have a picnic for them, and they enjoy that event. As I mentioned, we try to keep the activities folks, which I work with, will keep their calendars updated, which are on the website. And we try to get, all holidays. It'll be a religious holiday, but especially like the patriotic holidays, Veterans Day, Memorial Day coming up. As I mentioned already, Flag Day. So a lot of activities always going on at the homes. And again, like I said, the application is online. We have admissions coordinators at each of the 6 homes. So any of my team here at BBH or at the NA6 homes, you can always reach out to them with help with admissions or questions about the homes. Thank you. Anything?
Samantha, if I could add on to one thing from Jean's presentation, as Jean mentioned, our admission policy is first come, first serve. So as many of you know, typically we don't plan too far ahead for nursing home placement. It's usually the result of an acute medical episode, a stroke, a fall, and our lives kind of get turned upside down and we look for solutions. So currently within the Commonwealth, 5 of our 6 locations have waiting lists, and some could be quite longer than others. So what we encourage families to do, and our admissions team is here to walk you through the process, is to list your first preferred choice of location, but also list a second and third preferred choice, because we can expedite some admissions into homes that have openings that are available immediately, and then work with the family and the veteran about transferring if they prefer to go to a different geographic location based on where their family might be located. So our admission team's doing a great job. We're working through these waiting lists as quickly as we can, but we want to ensure that we're able to place veterans and their spouses in a timely manner. So please, I encourage you to reach out to Gene and his team if you have any questions about admissions into any of our state veterans homes. Thank you.
Travis, this is General Weigel again. Real quick question. We talk about long-term care. Many aging population and folks are concerned about the cost of care, and many people have researched and skilled nursing can be upwards to $20,000. Our veteran homes provides a different service for veterans. Can you explain EVR, the cost of care, and 70% disability? Because I want veterans to know that it's important to reach out to our veteran service officers. Let us help you do your claims and benefits to get you your disability ratings and the benefits. So can you just kind of touch on that for us?
I sure can. So our revenue department will look at each veteran on a case-by-case basis to ensure that we can maximize your benefits. So for veterans with a 70% or greater service-connected disability, the federal VA will pick up the full payment for skilled nursing care. EVR, which is the Enhanced Veterans Reimbursement Program. EVR it's a Medicaid program. It's set up for residents of Pennsylvania veterans homes who fall below a certain threshold. Really, one of the main benefits of the EVR program is that residents are able to obtain a $450 a month allowance as compared to private homes that only allow you to keep around just under $50 per month. So it is a hard process to navigate. It's very stressful and overwhelming for families. So again, I encourage you to reach out to us. That's what we're here for. Our revenue team and our admissions team, we're here to answer your questions. Make sure you get the benefits that you're entitled to. If you're missing paperwork or you have questions about how I obtained the paperwork, we're here to hold your hand and guide you along that way.
Thank you, Travis. And to everybody online, again, please go to PA Vet Connect. If you're not sure where to find a veteran service officer that can help you and navigate the claims process, that's what we're here to do. Please reach out to DMVA. We will find you someone to look at your benefits, look at your service connectivity. I know many people are proud and they think they don't deserve the benefits, but you've earned them. They're available to you. So I encourage all of you to at least reach out to us and ask on PA Vet Connect. So thank you. Thanks, Travis. Sam,
Sorry, man.
Yes. Thank you, Jean and Travis, for that great information. Before we move on to hearing a bit about the VA Caregiver Support Program, I do just want to remind everybody that if you have a general question, please do feel free to put it in the chat panel tonight. We will have time at the end of the town hall where we will go to that panel and field any questions out of it that our team could not directly answer. If you have something more personal, however, best option would either to be include your first initial last name and a way to contact you, and a member of our team will reach out to you within the next 3 business days, or you can get in touch with us at our PA Vet Connect resource account, and that email address will be provided on a later slide during this town hall. So at this time, we're going to move on and we are going to hear some information around VA Caregiver Support. Renee Shandor is the Program of General Caregiver Support Services Coordinator at the James E. Van Zandt VA Medical Center, which is located in Altoona in Blair County. Ms. Shandor is a licensed clinical social worker with the Altoona VA Medical Center. Beginning in 2017, she served as the primary care social worker before transitioning to the Caregiver Support Program in the summer of 2021. She currently serves as the Program of General Caregiver Support Services Coordinator. Renee received her master's degree from the University of Pittsburgh in 2015. Renee, I'm going to go ahead to your presentation. Please just tell me to advance on your cue.
Thank you so much, Sam. Good afternoon, everybody. It is an honor to be here with you today to provide just a general overview of the VA Caregiver Support Program. Next slide, please. So today we're going to cover just an introduction to the VA Caregiver Support Program. There are 2 unique programs under the Caregiver Support Program, or CSP for short. We have the Program of General Caregiver Support Services, or PGCSS, and the Program of Comprehensive Assistance for Family Caregivers, which we refer to as PCAFC. And the 2 caregiver support programs are administered under the Veterans Health Administration. So in late 2007, as military operations in Afghanistan and Iraq progressed, the provision of services and supports to family caregivers of veterans seriously injured in these conflicts moved to the forefront. Family caregiver issues became a focus of the President's Commission on Care for America's Returning Wounded Warriors, established by George W. Bush on March 8, 2007. In 2008, the VA Caregiver Advisory Board was established to develop the Caregiver Assistance Program. With the conflicts in Iraq and Afghanistan, new challenges presented themselves to our service members returning from combat with serious injuries that may have been fatal in previous conflicts. The service members require personal care services, which are often provided by family members and loved ones. In recognition of this significant challenge, in 2010, Congress enacted the Caregivers and Veterans Omnibus Health Services Act of 2010, or PL 111-163, which required VA to establish specific supports for caregivers of veterans. Two programs were established, the Program of General Caregiver Support Services and the Program of Comprehensive Assistance for Family Caregivers. Collectively, we refer to these two programs as the Caregiver Support Program. Pcafc was established and created for family caregivers of eligible veterans who had a serious injury incurred or aggravated in the line of duty. 10 years ago, the program began officially accepting applications for PCAFC. In 2018, the VA Mission Act required the VA to expand eligibility for Family Caregivers Program to caregivers of veterans of all eras in a phased approach, establish new benefits for designated primary family caregivers, and other changes that affected the program's eligibility and VA's evaluation of PCAFC applications. And these expansion efforts are being implemented in two phases. Veterans who were seriously injured in the line of duty before May 7, 1975 became eligible as of October 1st, 2020, and 2 years later, which is this coming October of 2022, veterans who served and were injured in the line of duty between May 7, 1975 and before September 11, 2001 will become eligible. So in other words, by October 1st, 2022, all veterans of all eras will be eligible to apply. Next slide, please. As I move into the specifics about the two programs, I just want to share with you some information about our amazing resources available to anyone interested in learning about Caregiver Support Program, as well as some helpful education and information for caregivers. And these two resources are the Caregiver Support Program website and the Caregiver Support line. The National Caregiver Support Program website provides information, including program information, zip code-based interactive team locator, contact information for our caregiver support line, resources for caregivers, and the online application link for the PCAFC program, as well as information about national calls, important updates and alerts, and much more. Next slide, please. The Caregiver Support Line is a toll-free number for caregivers, family members, friends, veterans, and community partners to contact for information related to caregiving and available supports and services. Information on caregiver support services, counseling, and education services can be provided, as well as referrals to your local caregiver support team. The Caregiver Support Line is available Monday through Friday, 8 a.m. to 10 p.m., and Saturdays from 8 a.m. to 5 p.m. The Caregiver Support Line is staffed by VA professional staff. Next slide, please. So the first part of the Caregiver Support Program that I'm going to talk with you guys about is the Program of General Caregiver Support Services, or PGCSS. And the mission of PGCSS is to serve caregivers with respect and service excellence through a wide range of support, education, and tools that empower them to care for themselves and for the veteran. Next slide, please. Caregivers who participate in PGCSS are called general caregivers, and this is a person who provides personal care services to a veteran enrolled in the VA healthcare system who either needs assistance with one or more activities of daily living or needs supervision or protection based on symptoms or residuals of neurological care or other impairment or injury. They do not need to be a relative, and they do not need to live with the veteran. Next slide, please. So I want to give you a little bit more detail about PGCSS. We recognize that it was important that across the VA, all caregivers have access to the same resources and services, no matter where their veteran received care. And so we established the 4 core elements, as you can see here: education and support, collaboration and partnerships, outreach, and resource and referral. The first topic is education and support. So we provide one-on-one clinical support to help the caregiver care for the veteran and to care for themselves. This is based on the needs of the caregiver. Some caregivers may wish to have weekly check-ins over maybe a 6-week period, whereas others may want a monthly support call ongoing. We also provide many support groups. Other sites offer topic-specific support groups targeted at bringing together caregivers facing similar circumstances or caring for someone with a specific diagnosis. These can be offered in a number of modalities, via video telehealth or telephone, as well as in person when feasible. And collaboration and partnerships, caregivers are present throughout the VA and in our community. So it's really critical that we collaborate and maintain strong partnerships to be sure that the caregivers' needs are being met. These collaborations and partnerships happen at the national and at the local level. We often say the VA can do a lot, but we can't do it alone. And this is why our trusted partnerships are so key. The next one is outreach. We want to be sure that caregivers know that we're here for them. So we work to make sure that we are putting out communications to alert caregivers to what's available to them. We don't want to wait for them to come find us. We want to reach out and bring them in for that support. And the last core element is resource and referral. PGCSS helps caregivers get connected to the right services and support for them, whether that be VA or in the community. We want to be sure that caregivers and families have awareness and a connection to the resources available that best meet their specific needs. Next slide, please. So training and support is offered through different opportunities via in-person, online, and telehealth sessions. So I just want to touch base on a few of our education and support options. We have VA SAVE, which is suicide prevention training that equips caregivers to demonstrate care, support, and compassion when talking with their veteran who could be at risk for suicide. It offers important information as well as simple steps and actions that caregivers can take. This is an educational call that we in Altoona offer quarterly. The next one is called Building Better Caregivers. It's an online workshop with 6-week self-paced lessons with some facilitator guidance and a group support for caregivers of veterans with dementia, memory problems, PTSD, or any other serious brain injury. We also have the Annie Caregiver Text Program, which promotes self-care for both veterans and their caregivers. Annie can help manage stress and support self-care by sending 3 text messages a week with a focus on education, motivation, and activities to manage stress. And then we have our Reach VA Caregiver Program, which provides caregivers with problem-solving skills, stress management techniques, and specific information on disease-related concerns that are customized for each caregiver. Next slide, please. We also have Caregivers First, which is a caregiver skills group training program with the goal of connecting caregivers to one another and to resources to help them feel more confident, capable, and supported in their caregiving role. And then we have Peer Support Mentoring Program, which links caregivers to a peer who has experienced similar changes and situations in order to provide an additional layer of support and guidance along for the caregiving journey. Next slide, please. So now we'll move on to collaboration and partnerships. The Caregiver Support Program at each local site hosts an annual summit for VA community providers to include caregiver-specific topics. The summit includes VA and external organizations that support caregivers and their families. The goal is to create and increase awareness of the needs of caregivers in the local community and to provide available resources. We also have an annual caregiver and family resource fair at every VA facility for veterans and caregivers with a focus on caregivers and families, on Veterans Health Administration, Veterans Benefits Administration, local nonprofits, and county services. Next slide. Caregiver Support Program staff serves as a subject matter expert and are outreaching to various organizations, agencies, and stakeholders, including at events in person when we're able to, but currently a lot are virtual. And we do this year-round through planned events as well as upon request. Next slide, please. Caregiver Support Program staff work firsthand with caregivers to connect them with caregiver support programs, VA community, and partner resources. We have strong relationships with our VA and non-VA partners to help caregivers address any number of issues or needs that they may have. And next slide, please. Our second program is the Program of Comprehensive Assistance for Family Caregivers, or Pcafc. It's an honor to care for those who provide care to our nation's veterans through both PGCSS and Pcafc. Next slide, please. So there were several changes made to the program because of the Mission Act of 2018, which was designed to improve veteran access to health care. This includes the expansion of Pcafc to all service eras in a phased approach. Next slide. Prior to October 1st, 2020, Pcafc was available to veterans who incurred or aggravated a serious injury in the line of duty on or after September 11, 2001. The Mission Act authorized the VA to expand Pcafc to eligible veterans of all eras of service, occurring in two phases. The first phase occurred October 1st, 2020, and expanded Pcafc to eligible veterans who incurred or aggravated a serious injury or illness on or before May 7, 1975. Phase 2 is anticipated to launch October 1st, 2022. Next slide, please.
Hi, Renee.
Yes.
Hi, this is General Weigl. Sam, can you go back to that slide? Quick point of clarification. Okay, so when you first talked, you talked about veterans being injured and they're covered if they're prior to 1975 and then post 9/11 GI Bill. So I guess I want to clarify for the group on this discussion. Injured means if you're service connected, whether it's presumptive, Agent Orange, that's considered injured, correct?
That is correct, yes.
Okay, and so my second question, and I know you're not going to answer this, but I want to at least put it out there to discuss. So the group that we're missing is the Gulf War veterans in this timeline, right? So post 9/11, yes. Pre-Vietnam. So now we're talking about presumptives coming up for toxic exposure and burn pits. If that law and legislation changes, the probability that the Gulf War syndrome veterans would be included in this potentially.
I'll say yes, potentially. But again, that's not something that I can really answer definitively on.
Yeah, so if anyone's on the phone and on this call and you are a Gulf War syndrome veteran who has started your paperwork for burn pit and toxic exposure, just hold tight and we will make sure we keep up with the folks at the VA to make sure all the benefits when they roll out will include the caregiver. So I just wanted to touch, that's an important slide to top. I didn't want to miss this. I'm glad you showed it again, so thank you for that clarification.
Absolutely.
General Weigl, thank you so much for getting that clarification. And Renee, I know you have so much amazing content in here. I'm actually wondering if perhaps we could schedule with you another time to do a webinar of information on VA's caregiver support. But we're button up to 6 o'clock here, and I do want to make sure that we can get to our food resources and our information on protective services. If you wouldn't mind trying to finish up your remarks in the next 30 or 60 seconds.
Okay, sure. My apologies. So I'll skip over the application process, but right now, what you really need to know is that if you are interested in applying for the Pcafc program, so that comprehensive program, you can find our application on caregiver.va.gov. You can also call us. There are plenty of us who are absolutely more than willing to go ahead and schedule a time to chat with you about the application process. And the PGCSS, the General Caregiver Program, again, I just want to put out there that that is available to caregivers of veterans of all eras, regardless of service connection or anything along those lines. We provide a lot of group support, individual coaching, education calls, and that's available to everybody. The veteran just has to be enrolled in the VA, and this person, this caregiver has to be, an identified caregiver, doesn't have to be a family member, doesn't have to be living with the veteran. You just have to be a caregiver, and the veteran has to essentially sign a release of information agreeing that you are a caregiver. But I am happy to take any further questions. You can call us at the Altoona VA, and I am happy to speak with you further about that.
Great, Renee, thank you so much again for all this wonderful information. It's such an important program, and there's so many current and upcoming changes with it. So we will definitely get in touch with you and make a time to do a webinar devoted just to VA caregiver support to make that available for people that want to learn more, professional and veteran and caregiver alike.
Awesome. Thank you.
Thank you, Renee. So at this time, we're going to go ahead and we're going to move into our third poll for the evening that should appear on your screen here in just a moment. And what we would like to know, and as a note for this poll, you'll see on the side of the prompt box, there is a scroll bar. You're going to want to scroll down because there are about 7 different options there. We just want to make sure that you don't miss some of those potential answers. So if an older veteran or surviving spouse is in need of food assistance, which of the following programs could they look into? Go ahead and select those that you feel would be the appropriate answer and click submit. We'll give about 15 seconds for this one. There's quite a lot to read there. Okay, and the answer to that question is all of the above. So every single one of those programs listed, as well as others that aren't listed, do exist here in the Commonwealth. And there's just a wide variety of support for those who are experiencing food insecurity. So right now we are going to turn things over to Pam Hicks. I'll introduce her and then go to her presentation to give us some more information about a food bank and then some specific programming therein. So Pam Hicks is the Mobile Distribution and Programs Manager for the Central Pennsylvania Food Bank. She has had the pleasure of working for the food bank for over 10 years, helping to develop and grow programs, primarily in the northern tier region of the Commonwealth. Within the last 3 years, her role has changed to oversee all of the mobile distribution team, including military share, working to expand and sustain programming across the 27-county territory of the Central Pennsylvania Food Bank. Pam, before I turn it over to you, I do just want to be clear for everyone that there are food banks covering every single county. Your food bank, however, is more in the central part of the state. So fear not. If you're in a different part of the state, there is support for you. So Pam, I'll go over to your presentation now and just tell me to advance on cue.
I will, and thank you so much everyone for having me here. I am happy to share the work that the Central Pennsylvania Food Bank does, and specifically the work that we do in serving our veterans and military family. We are a nonprofit organization, and our mission is fighting hunger, improving lives, and strengthening communities across our Central Pennsylvania territory. Next slide. You can see it's kind of our work in action. So we are on the road 6 days a week within our 27-county territory. We take off on Sunday, trying to get that food out to the partners that can then mobilize it and get it out to the communities in need. Next slide. So this is really a representation. We like to say this is our business model on how the food bank works. When we talk food, we talk millions and millions and millions of pounds that we are getting into through our doors and out the door at the same time. So, and that is not done alone. So I just want to briefly go over this chart. We collect the food and get donations. Food comes from many different areas. We are part of receive food from Pennsylvania Department of Agriculture or from the USDA. Some of the surplus and abundance that comes through, whether it's through farms that weren't able to sell all of their product. It could be food that's sitting in warehouse that can come into be a surplus, and we are a food bank that can accept that surplus and then send that out to our partners. We also are part of Feeding America, so because of that, we have some of the benefits of receiving from larger corporate organizations, your Walmart and Sam's Club and Conagra, and we get bulk donations in. When they come through our doors, in order to get those out to our partners, they have to be sorted and packed. Again, we use thousands of volunteers to get our work done. So we have a warehouse designated just for that packing and sorting of food. It comes in bulk. We sort it down to smaller sizes, and then it gets distributed out to our partner agencies and to the programs that we serve. From that point, then, it gets distributed out to the neighbors in need through our volunteers. Next slide. This is a really nice visual of the 27 counties that we are in. Those red dots really represent where our partners are located. I can tell you this is probably an old map. When COVID hit, some of our partnerships increased. So you would probably see more dots. The heavily concentrated dots you can see kind of represent where our warehouses are located. We do have two separate warehouses. One is in the Harrisburg area. The other is in Williamsport in the northern tier. Again, we serve 27 counties, and we have over 1,200 partners. And obviously, that's how we're able to meet the needs of so many. Next slide. I kind of wanted to take this opportunity to talk about programs specifically. When we say partner agencies, I'm talking about your food pantries that will pack up food to give to families that qualify, soup kitchens where they're cooking the meals and providing those out, emergency shelters. But programs specifically are something that, really fall underneath our responsibility. As opposed to our partners, meaning we control those programs. So for the senior programs, I think it was talked about earlier, the PA Senior Food Box Program. So we serve seniors through that program, up to 5,000 we are sending out every month. And our mobile distribution, and that, again, we'll talk about the military share. We have youth programs. Obviously, these are all programs that are targeting specific individuals. Youth programs, they're backpacks and kids cafes. So there's feeding programs so that a child is not going to go hungry. Senior programs, again, it's a supplemental program just to meet the needs. And a lot of those receiving are veterans. Health innovations, we work with hospitals and really kind of work at more of a specific targeted program, working with reduced diabetes, just really some more of the health initiatives, and providing food that's going to be healthy so that they can do that, kind of a prescription program. SNAP outreach, we do have a SNAP team. Sometimes it can be very difficult and intimidating for somebody to maybe apply for those benefits. So we have a team a hotline they can call and apply through that process, and then they would be filtered out so that we just kind of make it a little bit easier for them. But I really want to kind of focus on our mobile distributions, which we consider them just-in-time distribution, meaning our sites don't typically have the capacity to store food, pack it up and send it out. So we are arriving just in time prior to their distribution so that we can meet the needs in their communities. And that does include our military share programs. Next slide. And this is just kind of an overview. Again, I really wanted to focus on the military share program that serves veterans and active duty military families. We call it Fresh Express, meaning we really want to provide the freshest of product. We want to provide those fresh fruits and vegetables, the meat, milk, eggs, all of the product that can be very expensive when you're on a fixed income. And most of the military families are veterans above 60, and they are surviving off of a fixed income. So it's designed to serve their families in addition to the veteran. We do require a DD-214. It's kind of a way to prove that they're a veteran family. One thing that this program is maybe just a little bit different. Again, we are a nonprofit, so this is a donation-based program. It really is, we like to say it's a cost-sharing program. So we work with different organizations, mainly the VAs, the American Legions, the vet associations that have the capacity to raise some of those funds that they can place onto their specific program so that it can help cover the cost that is needed for these boxes. When we talk about a supplemental food distribution, that's exactly what it is. It's in addition to what these veterans can get anywhere. So they can still go to a pantry if they have a need. They can still receive SNAP benefits, and we're going to encourage them to do that and provide those resources so that they can do that. But what's included with this distribution, and most of our partners distribute just one time a month, it is a box of non-perishable product, typically around 20 pounds. It has cereal, dry and shelf-stable milk, canned goods, fresh fruits, vegetables, juice. The produce box is around 10 to 20 pounds of fresh produce, 5 pounds of meat, milk, eggs. The etc. is cheese, butter, anything that we have access to that we feel could really benefit and enhance that distribution for that particular month. The partners, again, I kind of spoke of who we partner with. There is a process to become a partner, and we are very fortunate to have many across our territory. The one thing that I want to say about this program, and listening to so many wonderful benefits that are available for veterans, is this is a fabulous platform to provide access for those veterans to receive that information. Our largest site serves about 350 to 400 families. Imagine that target audience every month of 400 families coming through. So it's really used as a really good location just to get that information to them so that they know all the resources that are available to them within their community. And again, it's a good way for us to provide access to healthy food to all of the veterans. Next slide. This is a snapshot of the counties that we are currently in serving our military share, and within the counties where they're located. You can see that York County probably has the strongest representation, and I have to believe it's because of the veteran affairs that we work with there. And we are very connected, and they do great work. We've used them as a model for many of our sites establishing. Most recently, Franklin County is our newest one that just came on. So we had our first distribution there. Next slide. And again, I kind of talked about just very briefly about volunteering. And I just wanted to say, to make this program work, let's imagine that we send out 4,000 boxes across our service territory to serve veterans every month. Somebody has to pack those 20-pound boxes. Somebody has to get the produce ready. Somebody has to mobilize that. We can't do that ourselves. So we rely on volunteers to do that for us from the food bank level. From that point, then the food gets distributed out to our host site, to our partner site, to the Legion, to the VFW. They have volunteers there that at that point serve the veterans that are coming through that have signed up for this program. So it takes a great deal of volunteers, but it's a very rewarding program, one that I absolutely encourage everyone to go visit if they have not seen something like this in action. Again, it takes donations, but we are part of the Charitable Food Network and have the ability to purchase product at greater savings, so we can get more bang for our buck. So we do, again, we do survive off donations, and we are always fundraising for that. And advocacy, we will be a voice for our veterans. We will try to advocate for all of the needs and the food needs for these families. And we do have a department within the Central Pennsylvania Food Bank that is dedicated specifically to the veteran into the advocacy process. Next slide. And lastly, this is kind of just a brief representation of all of those volunteers that are out there working across those sites. COVID was a game changer for us, I must say, but the one thing that was absolutely remarkable is there was not one military share site that stopped serving through all of COVID. We changed the model. It became a box to trunk model, and it was contactless, but we made it happen, and all the veterans still received the product that they became accustomed and they need to survive. So we absolutely thank all of our volunteers, and we ask that if you can, join us in the fight to end hunger. Next slide.
Yeah.
And that's just a thank you so much for allowing me to present. And if there's any questions, I would welcome answering any. And the next slide would have all of our contact information. We do have a team that works within the mobile distribution department, taking care of the military share and our Fresh Express, and you can reach out to either one of us, and we will be glad to answer questions. And I thank you so much.
Pam,
Yes.
thank you so much. I'm sorry, Sam. Pam, I just want to say thank you. We really appreciate what you're doing for our veterans. And for those on the line, I know she mentioned to access care, you need to have a DD Form 214. If you don't have a DD Form 214, if you lost it like many veterans do, please reach out to dmva.pa.gov, PA Vet Connect. Either way, we will help you. We have access to DD Form 214. So if you don't know what that is and you're a family member, that is your access to benefits, that document. We can find it for you. Additionally, Pam is one wonderful example of nonprofits that help our veterans. For everyone on the line, if you want to figure out how you can help in so many areas, Pennsylvania has a Veterans Trust Fund where if you go to get a driver's license designation, the money that you pay for that designation as a veteran goes to our Veterans Trust Fund. Anyone can make a donation. We help fund over 1,900 partners, nonprofit agencies that are taking care of veterans, whether it's a homeless shelter, a food bank, a PTSD program, so many programs out there for veterans. Veterans Trust Fund is one way you can donate. So thank you again to Food Bank. And sorry, Sam, to jump in there. I just wanted to make those two comments. Thank you.
No need to apologize at all, General Weigl. Thank you for providing some additional information. And Pam, thank you very much for your brief. The slide on the screen right now does just have some information regarding how to get in contact with some of these specific programs for food resources. Please do note that this is not an exhaustive list by any stretch of the imagination, but they're just some of the key programs. Both Pam and Tom Sneddon had touched upon the Senior Food Box program, but Secretary Torres, if you would like to, maybe just take a minute or two, if you have anything additional that you might want to say regarding congregate or home delivered meals, or even the Senior Farmers Market Nutrition Program.
Sure. Again, if anyone is in need of nutritional support, the area agencies on aging can help you. Some of our programs will entitle you to home delivered meals. And if you participate at a senior center, again, that would provide congregate meals, so an opportunity to socialize with other adults and enjoy a meal at the same time. We have the Senior Food Box program, and anything else I'm missing?
Farmers Market.
Oh, and the farmers market. So there is a program from Department of Agriculture where there's a voucher, and actually I think it's in process right now. Recently announced that this year's farmers market vouchers program it's open to anyone who is eligible to receive those vouchers, and then you could go to a local farmers market and take advantage of fresh produce and vegetables and fruits.
Great. Secretary Torres, thank you so much for that additional information. This time we're going to go to our last poll for the evening that should appear on your screen here shortly. And in this question, we're just asking you, true or false, veterans must pay money to receive qualified help in applying for veteran benefits. Is that statement true or false? Go ahead and select your answer and click your submit button. And the answer to that question is false. Veterans and their beneficiaries do not have to pay anything in order to receive high quality assistance in applying for veteran benefits. And that goes for federal, state, and local level veteran benefits. We want to just take a minute or two to draw attention to the fact that, there are some unscrupulous players out there who are targeting our veterans and trying to what we would call poach their VA pensions. So this type of activity can take a lot of different forms. Some examples of it may be being cold called by someone or getting an email out of the blue saying that they can help you obtain your VA pension. It's just going to cost you $350 for them to do the application for you, for an example. People who are charging for help in filing forms or submitting applications, entities that are selling questionable financial products, even some unscrupulous financial planners who are saying that if you pay them, they can help you restructure your assets and move your income and assets around in order to make you qualified for this this pension, which really does have a financial eligibility limit to it. Other examples would be the selling of in-home care products that are completely overpriced or are never actually provided, or individuals who are promising you that if you pay them, they'll help you apply for this VA pension and they will definitively get you that pension. They may even try to sell you a lump sum or advanced payment on a future awarded pension. So all of these things are examples of pension poaching, and we bring them up just to draw to your attention that you never have to pay someone to help you apply for your veteran benefits. There is a very vast network of VA accredited veteran service officers available in the Commonwealth of Pennsylvania, and they provide free and expert assistance in learning about and applying for any veteran benefit. As General Weigel had mentioned earlier, you can find a veteran service officer near you by visiting the PA Vet Connect website at dmva.pa.gov/vetconnect. We have a VSO in every single county in the Commonwealth that is known as the County Director of Veterans Affairs. There are also accredited veteran service officers at 5 of our service organizations: the American Legion, the VFW, DAV, Vietnam Veterans of America, and AMVETS. And here at the department, we also have accredited veteran service officers on staff. So there is never a reason that any veteran or beneficiary should not be able to find free assistance in applying for their veteran benefits. Now, if you do find that you know that you have been scammed or defrauded or have experienced veteran pension poaching, or you even suspect it, we are encouraging you to make a report as soon as possible to the PA Attorney General's Military and Veterans Affairs section. And we provide you there on the screen the phone number to call, which is 717-783-1944. You can also email them or file a complaint online via their complaint form. I know that's a lot of information very quickly, but we wanted to bring about to your attention one example of exploitation that is specifically targeting aging veterans. There are a lot of other types of exploitation and scams that are happening out there. And Secretary Torres, I'm wondering if you can just take the next couple minutes and dive a little deeper into how the Department of Aging works every single day through its network of area agencies on aging to help protect older Pennsylvanians, not only from exploitation, but also from abuse, neglect, and abandonment.
Okay, thank you. Yes, I mentioned earlier that since I started this position, in strengthening protective services for older adults has been a priority. We have a Bureau of Protective Services, and we also have a statewide elder abuse hotline, which is 1-800-490-8505. And if you suspect that there's any elder abuse going on of any type, you can call that line. and we will take relevant information down and assign it to the area agency on aging where the abuse is taking place. As Sam mentioned, over the last 2 years, we've been working extremely hard on financial exploitation because unfortunately we continue to see that increase. We saw it even during COVID testing, even trying to get vaccines. There was all kinds of scams trying to be perpetrated on older adults, along with the usual gift card scams, your family's in trouble scam. Most of the financial exploitation is being done, unfortunately, by family members, so that has made it tough because some district attorneys or law enforcement feel that it's just a family matter. So part of what we've been doing, we put together a financial exploitation task force. We've been working with other state agencies to share more information so that we can try to be more proactive, more timely on dealing and addressing financial exploitation. We've engaged the financial institutions, both banks and credit unions. We've worked with the Alzheimer's Association, with the healthcare industry. One of the things that we're doing is facilitating secure communications between financial institutions and area agencies on aging so that, again, when there's suspected cases of exploitation, that information can be relayed quickly and information can be shared. We're working with the Pennsylvania State Police. They have put together a unit to work on retail scams, working with the Attorney General's office as well. So from where I see it, where I sit, really trying to get a handle on this is going to require kind of a full court press from all different areas, people working together. With the healthcare industry, we're working with Alzheimer's Association to provide a toolkit for primary care physicians. So when they diagnose early stage dementia, there'll be resources available beyond what may be needed to attend to the physical and mental health needs of the patient, advising them to really start thinking about how do you protect your resources and your assets. So if anyone's interested, you could go to our website. You'll see a full report there, a full study we did on financial exploitation. You'll see the recommendations, about 15 that are actively being worked on that came out of all the work from the Financial Exploitation Task Force. And in a couple of weeks, I'll close with this, we are going to introduce a web page that will be a financial exploitation resources page to help individuals see what kind of services and supports may be available and information to help prevent financial exploitation. So thank you.
Thank you, Secretary, for that wonderful information. It really is a very important program that you all offer over there at the Department of Aging to help protect our older Pennsylvanians, including our older veterans and their spouses and surviving spouses. At this time, Corey, Chip, I just want to go to you. Were there any questions put into the chat panel that needed to be fielded live, or have they all received answers at this point?
They have all received answers.
Wonderful. You guys are great behind the scenes there.
Couple comments in there, but for the most part, the questions have been answered.
Great. Well, thank you. So at this point, I just want to remind you all, this is the point at which you will now in the chat panel, you should be seeing a link to a post-event survey that was placed in there. We do ask that before you log off for the event, that you do click on that link. It will take you to a form. I think it's like 6 or 7 questions, very quick. We just kind of want to gather some feedback from you all about the value of this town hall event, as well as just some basic information, nothing personally identifying, so don't worry about that. If for some reason tonight you feel that your question was not answered, or if you had something that you just did not feel comfortable asking during the town hall, please do reach out to us at the PA Vet Connect resource account. That email address is ra-mvvet-connect@pa.gov, and it is there on the screen for you. Again, a member of our team monitors that RA account every single work day. So when you email us, Just be sure, if at all possible, to give us the county that you live in. That will really help us get you connected to the staff member that can best support you. The same thing goes if you have a personal issue or some sort of situation that you've been trying to resolve and you're just not getting any satisfaction, or you feel that you need some additional support in that. We are here to support you. Please do make use of us. So at this time, I just want to thank everybody for joining us this evening, all of our attendees, and especially our panel of subject matter experts and veteran advocates. Thank you for your time. Please do join us for our remaining virtual veteran town halls coming up this summer and fall. July 13th, we will be discussing resources for homeless veterans. September 14th, we will touch upon transportation issues that our veterans face. And in November, on the 2nd, we will be honoring our veterans for their service and sacrifice. Again, I thank you all for joining us, and I hope you all have a good evening. This concludes our town hall.